Assalamualaikum. We are undergraduate students from Islamic Science University of Malaysia in Dakwah and Management field. We decided to execute a talk program about the influence of smoking that will focus on adolescents. In 1990, Morris and Koyama have stated that one of the major challenges faced by today's adolescents include the influence of smoking, and the average age that start to smoke is under 15 years old. And in 1989, United States Department of Health and Human Services reported that 90% of smokers starting to smoke legally under the age of 21. Smoking is an important significant because it affects the health of smokers and non-smokers. Obviously, adolescents are among the main prevention goals, and we may play a vital part in preventing young people from smoking.
For your information, setting goals is an initial steps to develop a project, and it is become an important thing in implementing it. So our goals is, first, to raise awareness among adolescents about the increasing percentage of smokers. This awareness needs to be given attention because smoking culture is very bad, especially to the adolescent. 2. To raise awareness of the disadvantages of smoking culture. As we know, smoking can have a detrimental effect on a person's health and also can affect a person's moral. So next, about objective. In general, this program is aimed at researching the culture of smoking and helping in providing the awareness of a healthy lifestyle. So, the objectives in our programs are, first, to provide exposure about harmful cigarette contents, especially to adolescents. 2. To provide awareness of dangers of smoking that adversely affect health as well as personality. 3. To exposing smoking prevention measures that need to be taken, especially to adolescents. So next, about the outcomes. The outcomes of the project after it is implemented, which we are really hope. First, smokers gain the awareness of disadvantages of the smoking and also the determination to quit smoking in their life. 2. We sincerely hope that this project can help in terms of a decrease in the growing percentage of smokers, especially among the adolescents. 3. The adolescents can give attention and priority about the awareness of the dangers of smoking that convey through this project.
I will explain about the description of the program. Okay, smoking and its complication will put a strain on the country's healthy services while affecting the quality of life of the patients and families involved. So, we decided to implement Tak Nak Merokok program at SMK Semarak Nilai Negeri Sembilan on 23 of January 2021 from 9 am to 1 pm. It is because of our awareness of the increasing number of smokers growing in our country and increasingly widespread. Smoking is one of the causes of the increasingly serious health problems in the country. So, our focus is to give exposure to adolescents what is the content of the cigarette, how cigarettes can affect the health of the individuals, and how action to prevent from falling into the symptom of smoking. And then, we target to all students in SMK Semarak as our participants because they are the generation that expected to disseminate the information to the community outside the school and in turn can change the practice and way of life towards a healthier. This practice need to be nurtured since school. In this talk program, we have invited Encik Azmi bin Mustafa, who are Director of Treatments, Medicine and Rehabilitation at the National Anti-Drug Agency, and Dr. Noli binti Abdullah Jabbar, who are public health and medical experts Selangor State Department of Health Officer to deliver a talk on this program based on the objective we have set. Furthermore, we try to put all these objectives by implementing a talk program consisting of 2 sessions. In first session, the forum with our guests, and then go to the next session, which is Q&A with students. We choose talk program as our approach to motivate them because we think that the talk program they are not so heavy and not too hard for students to receive content from the program.
So next about our organizational capability. According to the proposal, this program planned by representatives from students majoring Dakwah and Islamic Management at USIM. We are planning to execute this talk program because we believe that we have certain capabilities in running this talk program. First, our capability is about we are an active youth that able to move actively and be ready in any situation as well as able to come up with new ideas and plans. 2. Young people like us are also easy to get along with the adolescents because we are able to dive into their soul and understand their situation. Finally, we are able to work with well-known organizations and also gain their support in terms of efforts as well as financial aspect.
For personnel and staff in pattern position job scope, the participant manager is Nurhamiza binti Ma'ahe. There will be 3 job scopes. Firstly, prepare a schedule of members on duty in their respective units. Secondly, ensure the preparation of the equipment list in advance. Thirdly, guide participants before, during, and after the program. Next is participant registration or certificate. Is Atika Piti Jamal. There will be 3 job scopes. First, make registration of participants. Secondly, prepare the relevant form. And thirdly, prepare a certificate of participation. Its refreshment is Afifa Filza binti Nur Azli. There will be 3 job scopes. First, provide adequate food and drink for all parties. Secondly, prepare a table and as well as a cooking menu for the program. And thirdly, provide an estimate of sufficient food expenditure. Safety or technical is Nur Ifa binti Ashari. There will be 2 job scopes. Firstly, responsible for the safety of all parties, and secondly, ensure the smooth running of the program.
As a guarantee of the sustainability of the program, we have take some follow-up where we will hold regular seminars or talk at school to collect and identify adolescents involved in smoking habits once every 3 months. Next, we will maintaining through a good relationship between families whereby our organization persuade to ask for support from families such as spending time with teenagers. We will work with the National Anti-Drug Agency for legal action against adolescents involved in smoking misconduct. To sustain gazetted some areas as non-smoking, the collaboration between Tobacco Control Unit and FCTC Secretariat Disease Control Division such as hospitals and clinics, entertainment center, public toilets or shops, so the smokers will obey the law that have been set. Next, we will use reference resources as a source for interpreting the software such as modules. The module include a solid feeling on what smoking is and the risk to teen of smoking practices. We also provide a reasonable number of members of the committee such that the follow-up initiative to be introduced runs seamlessly for 20 members in total. We also raise the fund is through donation from public and also Malaysian Ikram organisation. As a gift to the entire nation, Ikram aims to uphold Islamic rule in Malaysia and fostering social justice and social well-being.
Then, I continue to the budget of this program. We estimate 800 ringgit to run the entire program, and we have raised funds to implement this program as much as 646 ringgit to sponsorship, donation from public, and fundraising program that we have worked on in realizing this Tak Nak Merokok program.
As we know, evaluation is a systematic analysis and observational determines the meaning or importance of a development program. In order to realize our working plan in the social problem of the dangers of smoking among adolescents, some assessments have been planned as the level of effectiveness of the community program that we will run. The first evaluation is survey questionnaire that aim at collecting particular knowledge from the respondent peak. We administer the questionnaire to ensure our program progress by develop their understanding by measuring the level of awareness of the degree of smoking dangers to help and beyond their age group by teenagers during school of the impact of smoking among adolescents. The second measurement is the Likert scale, which asks for the degree of approval on a symmetric agreement. Disagree scale for a sentence is the most popular rating scale. We will discover the degree of extent of teenager addiction to nicotine from the scale level we tested and then take follow-up steps after the program finish. Next, the approach of direct observational step, which assign to a teenager that involved in the smoking scene by photograph or record videos. We will take action from that monitoring. The goal, based on all measurements, are to ensure that the teenager alert to the dangers of smoking through this program.